Tips to pass your microbiology practicals as well as good scoring in Viva. The first, get up early, memorize all the spotters and tips how to identify the blood agar, chocolate agar, McConkey agar, LJ medium, thioglycolate medium, biochemical reaction, indole, methyl, red oak spores, citrate, McConkey with LF colony and LF colonies, and egg, various methods of all Macintosh field jar, seeds filter, all those things. There are a list of spotters that are available, and you ask for the list from your college department office. They will, or a technician who is in charge of the examination. They will give a list of spotters. What are that? Make memorize all the spotters. Spotters are the things which you get 10 out of 10 marks, and they're very important. You should identify them and memorize them, and write 2 points about each spotters. You get 10 marks. That's first thing. Once you finish, then you, though important thing that is very important, most of them fumble is gram staining and Zealand staining. What happens is most of the students are scared of staining technique because because invariably we give our 10 or 12 times staining techniques. They don't come, they remain absent. Sometimes they don't, they see with friends, and they push off. And most of the time they are in hurry to go home, uh, especially 4 o'clock, 4:30, and they are not keen on and focusing and seeing them. Please, if you are not done, just go to the department and try to focus. You ask your technician to give a stains diet and try to focus, and you feel how you can focus and see the pictures, how gram stain looks and how Zealand stain looks. So please remember, before attending practicals, just go to the practical and try to focus the slides. And most of them, what happens, the mistake is they are tensed up and they forget the steps, and sometimes they stay in on the reverse side, and they fail, and sometimes they break the slide, and some girls starts crying and they ask for the second slide, and some of the examiners are very strict, and some of them may shout at you, and you may get depressed, and sometimes you feel very bad for not doing the practicals. Or you should be confident, and morning you get up on the day of practicals, dress up nicely, wear a neat apron, don't wear a shabby apron, and comb nicely and dress up nicely, take bath, put up some nice perfume, come to the practical hall, and don't get scared. Examiners are all there to assess you. Not nobody has got intention. Nobody comes to the examination to fail you. So they want to assess you whether you have understood the subject. These are the basic requirement, because it's a lot of clinical applications by doing grams and Zealand staining. So take the slide and make sure that you stain on the proper side. First, 4-step procedure: gram stain, violet, grams iodine, mod and decolorizing agent alcohol, and counter stain. So once you stain, you focus it, and most of the time you don't get it because they try help from the technician or experts, and they are also scared to help you in the examination because some examiners are very strict. They shout at you, and be confident. That's why you should practice couple of times before the practical examination, and try to go to the department, try to focus the stain slide. You need not have to stain. They give you a stain slide and you try to focus it. Once you stain, draw the diagram and focus it. Invariably give a mixture: gram positive cocci clusters and gram negative baseline. Most commonly asked questions is, what is the importance of gram staining? It is to differentiate between gram positive and gram negative bacteria. And example of gram positive cocci are staphylococci, streptococci, pneumococci. Gram negative are gonococci and meningococci. Gram positive bacilli are anthrax, clostridium, lactobacilli, erysipelathrix. All these are actinomyces, nocardia are all gram positive, rest are all gram negative. Coccobacilli, Bordetella, Brucella, Haemophilus, Yersinia. So these are the questions. Gram variation when gram positive organism look gram negative, it's called gram variation. Especially Streptococci undergoes gram variation very fast. Old cultures, when they grow the organism in the this thing. These are the questions that are commonly asked in gram staining. Zealand staining, most of the students, they struggle to focus the acid fast bacilli. Sometimes the sample is scanty of acid fast bacilli, tubercle bacilli. And the procedure, most of the colleges followed concentration method. We use it's Guinean and Gabbett's, where high concentration of carbamazepine is used. But usually most of the colleges they use old methodology, that you cover the smear with concentrated carbamazepine, heat it intermittently 5 to 7 minutes, taking care not to char, burn the slides, and decolorize with 20% sulfuric acid or hydrochloric acid, counterstain with methylene blue. The pink bacilli you should focus. Right, long, slender, slightly curved bacilli, beaded appearance, morphologically doing Mycobacterium tuberculosis. And questions that are asked: difference between tubercular and leprobacilli, and growth. How do you grow? And LJ medium. It is made up of egg medium, sterilized by invisation. These are the things that are asked questions. Be careful. And next question is stool examination. You are asked to draw the 2 eggs, and they will ask you how man get infected, or the clinical manifestation. And stool examination also is important. Then there is one applied exercise. They put up various biochemical reaction, give a case scenario, virology also, mycology also. And then OSPE and vary one or two auspices they ask, and you have get the list of what are the auspices that your college has prepared, and uh, prepare for it nicely, and be confident in answering them. AdCom modules where you have to attitude, ethical issues, and communication, how you come across when patient gets a needle stick injuries, or is all these things, hand washing, all those things. Sometimes AdCom modules, there are again list of exercises that are your colleges have made. You get the list of exercises what they have done and do it. So once you finish, you should be confident enough that you should score at least 70 to 80% in the practical examination. And I think don't get scared, be confident, and don't get panic. Don't get panic. Don't do, Be cool, and you'll become definitely pass. And nobody as such, they score. It's a scoring this thing. And YOC is 4 parts, and four examiners will be sitting, and go through all the simple things, tips, and you'll definitely pass with good scores, 70 to 80%.